right, Qualcast Nation, we have I'm going to say this truly, genuinely, a special episode today because this is somebody that I've looked up to for a very long time, and it's been a part of my life from the beginning of my medical school journey. Dr. Verna Yu, how are you doing this lovely afternoon?
Great, Quad. How are you? It's great to see you.
It's great to see you too. This is pretty, as I said, this is a pretty special moment for me. You are, as we heard in the intro, tons of accolades, tons of accomplishments, recent. How do I say this? This official title, Vice President of Pro. How do I say that? Your official title now?
Yeah, I mean, I would have troubles too because I don't think there's often physicians being a provost and VP academic for a university, but here I am.
There you are, and there's very few people, honestly, Verna, that I feel like has the perspective to be able to tackle some of our healthcare issues. But I'll open it up this way: where do you see some of our biggest concerns? Because I don't know if you agree with me, but I truly believe our healthcare system is in a crisis, and in my career, I haven't seen things as bad as they are, certainly here in Ontario and what you hear nationally. But where do you see the biggest concerns?
Yeah, so I mean, we all know workforce is a big issue within our healthcare system, but I just want to take a step back because I think what people have not really truly appreciated is what we've been through the pandemic. And we're not really acknowledging the impact that the pandemic has. And I've always said that we've been through a war as healthcare professionals. We've gone through almost a 3-year war with a virus. And what happens after a war? Well, you got to recover, you got to rebuild, you got to reimagine the system. And we have not appreciated that because, the pressures are continuing, right? And so it's no surprise that in addition to the attrition of our workforce, the burnout rates, people leaving the system, people not wanting to be in the system, to the delayed care, the chronic care that, all the pent up demand that is now coming to fruition. And so it's no surprise that right now we're sort of at a crisis state where every single province in Canada is struggling with even trying to provide the basics of healthcare. And I think that's where we are today. And I think we do have to acknowledge that we've been through a period that I hope that I never see again. But we've got to acknowledge that we're coming through hard times. And how long does it take for people to recover from a war? 5, 10 years, decades? It's only been like a year, more or less, right? So
it's a good point you make, and I felt this way on so many levels, not only through healthcare, but almost at a societal level, that we haven't really talked about. We haven't had like a recap or a debrief about what we've all seen. And one thing, like, we saw each other in early December when we were giving a talk, and one thing that really was highlighted for me is that this was truly, so many healthcare providers were affected. So many. Like, we talk a lot about what happened in the ICU, but you got to remember, as an example, the people on the wards that were trying to protect the ICUs, the people that stepped up. Like, all those folks went through a whole ordeal.
Well, and I think, Quad, to your point, I just want to even expand that, right? I think we tend to focus a lot on our frontline and, our clinical folks. But I can tell you that when I was, leading Alberta Health Services, the amount of intense pressures and stress that people, for example, in the procurement team were having, because they had to keep up with all the N95s. At one point, the US border shut down. We knew that. And so we couldn't get our shipments from the US. And so we were smart enough to diversify our procurement to Europe and to get some of our N95. So, and we had to do scenario modeling for procurement, just like you did for acute care capacity. And so there were, I would say that every facet of a health system delivery agency was stressed in the pandemic at a level that we've never seen. And so the stress, the burnout, the, leaving to other professions stems throughout an organization, whether you touch a patient or not. Because I've always said that no matter whether you're a clinician or not, you always touch a patient. It's just may not be directly, but indirectly. So I think the pressures were everywhere. And I just want to acknowledge that, because at least in Alberta, procurement kept us safe as healthcare providers, right?
Yeah, I'm so glad you brought this up, because there are a lot of unsung heroes when it came to the pandemic, and that's exactly it. Like we were able to feel comfortable and to do our jobs because of folks like that stepped up. Even the people, like some of the ones that I came to mind too, the staff that would clean the rooms, right? Like how scared were they? And I remember seeing one of our early cases where one of our cleaning staff went into room 17, our very first COVID patient room, and the fear in their eyes. And they, like many of us, they overcame that fear because of their sense of duty and really made a difference. And so, yeah, I'm really glad you acknowledge that, Verna. But in terms of how we address the lack of like human resources, have you had many thoughts in terms of how to address that? Because definitely, as you mentioned, we need to acknowledge that we've gone through a lot, but still, we need to be doing something to step up those numbers. And what comes to mind?
Well, I do think that what the pandemic did was really uncover some of the weaknesses of our publicly funded healthcare system. We've always had these challenges, to be honest. It's nothing new, but the pandemic just stressed it to a point where we were just not able to recover in the same timeline that we normally do. So I think that's first and foremost. And, I'm a very strong believer, as I'm sure you are, Claude, in a publicly funded healthcare system. It's one of the reasons why I came back to Canada after I did my fellowship training. And I'm really proud to be Canadian, where public healthcare is considered a human right, and we know that in other countries it may not be. The other thing that I think the pandemic has really uncovered is, the lack of integration for healthcare. And, an integrated healthcare system, understanding the flows of patients and how you can depressurize, along the pipeline of a patient journey is also a very important strategy to actually help manage some of the capacity issues that we're all being challenged with. So for me, that is a really important aspect if you look at workforce. And just to say, one of the things that I really believe that we need to think about when it comes to workforce is that, just to say, well, we're just going to thank people more, or we're just going to be really grateful and be positive. I mean, that's obviously very, very important, but obviously it's not the thing that's going to do it. It's not the answer, right? It's going to have to be a multi-pronged approach where you look at upstream. So it's about the training. You have to look at the pipeline, in terms of the training itself, and then you have to look at the downstream and the types of work. And it's also about being innovative, because one of the things that we're very stuck on as healthcare providers is doing things in a certain way. So we have our team-based care, these are members of our team, but perhaps we need to think outside that box. Maybe when we think about primary care, and primary care is a big issue in Alberta, as we know, and I know in other parts of the country where you can't even find a family physician, is that maybe it doesn't have to be a family physician as the first entry point. I know we've looked at nurse practitioners, but maybe it's even beyond nurse practitioners. So there's not enough of nurse practitioners or nurses. Maybe we look at the initial screening, and I know that in some other jurisdictions outside of Canada, as an example, especially in rural remote, they actually used, in one jurisdiction, they used retired teachers in an isolated area to be the initial screener for some of the public health issues. So maybe screening for diabetes, doing blood pressure checks, very, very simple things that you can train someone to do. These are retired people who are looking for things to do and they don't have any clinical training, but surely they can do a blood pressure. We ask patients to do blood pressures. Maybe you could do a chem strip. We ask diabetics to do chem strips. So I'm thinking that we need to think outside the box, because in this short-term period, people say, well, you got to add more medical school seats. Sure, but when is that going to impact the numbers? Not for 10 years. And so are there some other fixes that we can think of that are outside of our normal traditional comfort level? Let's challenge ourselves to think, what is it that communities need? Because I think it has to come back to what I call community-centered care. We talk a lot about patient-centered care, but there are a multitude of diverse communities which need different things. Let's look at what the communities need, and let's try to build a system that can serve the communities instead of doing the opposite, which is building a system first and then going to ask the community later, what is it that you need? Well, they may not match, and then you waste all this time, effort, and resources to come up with an answer. So, and the last point I just want to make, Claude, is that I think for me, the solution in our healthcare systems is really impacts every single person. And we often think of, well, you as a regional health authority, or you as a, Ottawa, General Hospital, you guys need to fix this. Well, if you think about it, the touch point periods for patients within an acute care system is really low, right? In the whole scheme of a year, it's really low, if at all. And so if you think about social determinants of health outcomes, where is the biggest impact? The biggest impact is going to be on the individual as a citizen, to say, how do I contribute to my health? How do I contribute to my health system? And how do I actually make sure that I not only look after myself, but I look after our healthcare system? But that takes concerted efforts, Claude. It takes health literacy, which is not good, we know, in the general public. And it addresses a multitude of different issues that I think if we can get citizens more involved, and I think the pandemic has offered that opportunity. Because if ever, any moment that people are more aware of all the different viruses that we have out there, as an example, it's now. So let's take advantage of that. I'm just trying to move that momentum on that, but not a lot of takers so far.
I mean, there's so many points here, but on your last one, that's when I recently did a social media post of people kind of pushing them and say, like, you know what, we all got to take ownership of our own health to a certain degree, and there's something to be said about that too, about having that global perspective of saying, like, hey, what can I do to help? Like, and part of that is taking some level of responsibility, saying, like, and I agree, this will take a lot of work, but that literacy of saying, hey, I do need to make sure I got my screening done. Hey, I do need to think about how I'm eating and being as fit as I can so I could manage all the obstacles in front of me. I think it's a bit of a novel. I mean, when I say it, it feels like it's intuitive, but it's a bit of a novel approach coming from administrators of saying, hey, you know what? This is a global issue, and a lot of us need to take it on ourselves. Like, what can we do, right? And I don't know. I feel like this. You're right. Like, during the pandemic, this would be or peri-pandemic. This is a kind of a time to maybe push that message, and see what people are made out of.
Well, and I think that we on the healthcare side, and I mean, I'm no longer in healthcare administration, but if you're in healthcare administration, we need to be able to empower and enable the general public to do that. Because I don't think, Claude, we can say to Mr. and Mrs. Smith, in rural Alberta that you need to do this. Well, how? They don't know how to do that. So we need to give them. We need to make them, as I said, health literate, and that starts in the early ages. Like for me, I believe in early childhood intervention. I believe in K to 12 education. I think there's a lot that we can do to promote health literacy in the school-age children. And I actually really believe, and of course I don't have anything to show this, although there are some anecdotal studies that shows that if you educate the children, that actually has domino effects onto the parents, right? That totally makes sense. And we've seen some of that in very specific studies in very specific areas. But the whole issue around giving people their data, Claude, I mean, my goodness, wouldn't it be wonderful if you had access to your health data to truly inform you? And so, as part of when I was in AHS, when I got the support and the funding to roll out the provincial EMR called Connect Care, if I had a legacy in Alberta, that would be it, because I believe that was a game changer for Albertans.
It's massive. I'm sorry. It's like you can't understand people. You cannot understate this, folks. Like us being in Ontario, where you got different EMRs for hospitals across the street. It's the same city. We got probably in terms of hospitals, probably about at least two or three EMRs in Ottawa, and that I'm calling it correct, right? Connect Care.
Connect Care, yeah.
Yeah. To be able to have access to your data wherever you are everyone in the province is an absolute game changer. From a cost effectiveness, from a patient-centered approach, community-centered approach, all the things. Like, that is a monster legacy, Verna. Like, I can't understate that enough. And but in terms of getting people's access to the data, like, I think this is something that, to whatever degree, whether it's through their handheld devices, through their laptops, through old school people getting it through the mail, I do think that's powerful. There was another point that I really wanted to reinforce on your initial solutions rant. It was that whole concept of who else can step up. And you mentioned how in some communities retired teachers are assisting with BP management, or taking BP measurements and so forth. This is another concept that I personally haven't heard of, which I think absolutely, when you think about, we ask our own patients to do this, and if you could train how many people in certain, over a specific period of time, to be able to assist with this, and it offloads a lot of some of the duties that either nurse practitioners or physicians' offices might do. That is innovative. It really is a great idea. And I'm just curious, do you remember where area people are doing similar activity in? I'm putting you on the spot.
No, I used to remember, but I can't remember now. But it was definitely outside of North America and somewhere in Europe, where they were actually doing this. So, but like I said, I think this is a really good example of community-centered care, right? Mm-hmm. And leveraging off on the communities to really be part of the solution. And we haven't done that with an intention and with a purpose. And I think the more that we can engage the communities to be part of the solution, that's really an important aspect of improving health outcomes.
I mean, I'll go as far as to say is the answer's in the community. Like, the community has the answer. Yes. That's been my belief. From especially day one. I from a concrete example, I look at some of the community initiatives when it came to the pandemic, when it came to increasing, reducing vaccine hesitancies in specific communities. It was all about talking to that community members. How do we reach them? What's the best route? And coming from up top, these solutions wouldn't have come through. And these were life-saving interventions. They were life-saving. And so I let's go further and just say the solution comes from our communities.
Yeah.
And then you mentioned integration. I just want to spell it out for folks, because a lot of people use that term like having a more integrated system, but even giving a more concrete example, what would be something that you could map out?
So, I mean, Alberta Health Services has changed recently, we know, so I can't speak to it now, but when I was leading AHS, it was one of the most integrated health systems in the world. At one of the congresses, I think it was the 2018 World Congress on integrated health systems, I think AHS was number 3, number 2 or number 3, most integrated. I think Denmark was on top. I mean, so we were competing with, some of the, well-known Scandinavian countries. And the reason why it's integrated is because everything was under there. So we had EMS paramedics, we had public health, we had seniors care, addictions, mental health. We had acute care, but acute care was only part of it. We had ambulatory care. We had joint ventures with all the primary care networks. So it was just basically everything that was in health was actually under AHS. And I'll just give you some examples, Claude, about why it was beneficial to be in an integrated system. And let's use seniors care as an example. We know that in seniors care, especially during the pandemic, some of the horrific outcomes that happened in Quebec and in Ontario. Well, in Alberta, and of course this is now changing, but in Alberta at the time, 40% of long-term care sites were in fact run by Alberta Health Services. And you can imagine that in some of the private enterprises and even for the not-for-profit, the complex, chronically ill seniors, people didn't really want those seniors, right? And so AHS would often take on those really complex cases, which we know are getting more and more. Your very typical healthy seniors, really is not that common anymore. But having that line of sight into the seniors' cares was very helpful to us during the pandemic, because what we used is that we used a risk-based model to, first of all, make sure we were able to audit the sites, all of them, 100% of the long-term care sites. We had sort of a risk barometer so that we knew which sites were high risk, so that we would go in with in-person visits. We had an ability to communicate with the long-term care sites so that any of our practices around PPE, around visitation, were all translated also into those long-term care sites. And we had a 24-hour hotline that long-term care sites could phone, so that if there were any acute issues, we had a team that was able to work with them. And then we were also able to also work on the decanting piece, so that if we had, too much, not enough capacity in the acute care settings, we needed to, offload and decant. We were able to do so in, a fairly seamless way with our long-term care communities. So through a multitude of that, I would say that if you look at the Alberta performance when it comes to seniors and COVID and outcomes, we actually did very well from the context. Yeah, sure, we had multiple outbreaks, who didn't? But we were able to really deal with those outbreaks very quickly. We were able to really temper the mortality rate for our seniors. And overall, I think that the seniors community was felt very, very supported by the AHS system in general. And that's just one example. I can give you a multitude of other examples where, for example, paramedics, because paramedics is within the system, we were actually embarking even before this, and I know that this happens in Ontario, but Ontario actually used the Alberta model to build on something which we call community paramedics. And so we were sending out almost 10 years of sending community paramedics out into homes with fairly ill people, and we were able to keep these people out of hospitals, and so we expanded it in some of the rural communities. But what was very helpful in the pandemic is that before the pandemic, we had a bit of a pilot on virtual hospitals, Claude, and we had a virtual hospital in Calgary, one in Edmonton. So these are patients that had a most responsible physician admitted to hospital, but they were kept at home. And, within the course of the pandemic, we went from about 260, sort of virtual patients to almost 600 of these virtual patients who would be cared at. They would have the virtual rounds in the morning. So very similar to the hospital routines, right? The care team would be in the home. They would do any diagnostic testing. If they needed any treatments, they would get it. And the feedback we got was obviously phenomenal, but it really allowed us to have pretty good sized bricks and mortar type of hospital to being a virtual type hospital where you could be really anywhere. So those are some of the examples that if they were not in the system, it would have never happened. And that's the creativity of how, if you've got an integrated system that talks to each other and understands that, my investment in home care will actually offset and improve my discharges, then I wouldn't be so worried if my budget went more to home care. So those conversations are happening too. So we transferred budgets. You know how hard it is to transfer budgets? Nobody wants to lose money, but when they can see the long game to say how it benefits them, those things will happen, right?
This gets me so excited. It's not even funny. There's so many things. So obviously, kudos for having an open-minded, innovative, creative environment where these things can be implemented. Like that paramedic program, brilliant. The virtual hospital, brilliant. For obvious reasons. But it's yeah, because I must say in our, like, within healthcare, we don't see that often. That ability to think outside the box and to get outside of our comfort zone, for many people outside their comfort zone, but it's essentially for the greater good, and not only the greater good, even the betterment for our patients. And so yeah, I just want to commend you for taking that on. And I don't know, it's like right up my alley, because it's what I love to hear. What we're all about on the show is creative solutions, ways of addressing a problem with the assets you have in front of you. And I must say, this is pretty incredible. I'm curious, is there anything else, Verna, that stuck out for you during your time at AHS that you're really proud of, that really sticks out in your memory?
Yeah, I mean, I would have to say the thing, I mean, other than Connect Care that we talked about, and I talked about, if that was my one legacy, but actually, the thing I was probably most proud of is moving the culture of AHS to one where we're just proud of the organization and proud of the incredible teams of people who really dedicate their lives and sacrifice, make sacrifices to do what they do in helping Albertans. And it was funny, I joined AHS. I was seconded over to AHS in 2012 from the University of Alberta. And when I went over to AHS, it was a really difficult time, because they just amalgamated about 2+ years into it. And there was a lot of legacy culture from the hospitals and from the different, 9 regional health authorities. And so, AHS was also in the news all the time, and negative news, right? So people were just not happy. They didn't know what it stood for. They weren't proud of it. I remember myself and 3 other buddies did sort of a bike-a-thon, and it was, a 200-kilometer trip, and we were kind of making a joke, like, should we be wearing like an AHS t-shirt or something? And we said, no. We didn't want tomatoes to be thrown at us or anything, But, the point where I was so proud of the organization was in 2016. So I just had taken over the helm in January of that year. And, in the summer, we had this really bad multitude of wildfires. But I don't know if you recall, Quad, about Fort McMurray being evacuated. Mm-hmm. And so Fort McMurray, the wildfire, it was actually the largest Canadian evacuation of a city or a town. It was like 88,000 people that were evacuated from the whole town. And about 25% of people actually lost their homes during the wildfire. And so you can imagine our staff, who are also victims, right, of the wildfire. And we actually evacuated the hospital. The hospital was about 105 beds. There was a long-term care component to the hospital. And we were able to evacuate the hospital in 2 hours to safe locations. And we were actually able to relocate all of those into the beds that they needed into Edmonton and surrounding regions within 24 hours. So the concerted effort it took, you can imagine, to coordinate all of that was unbelievable. But what was really proud for me was how we recovered from that. I had people who were emailing me asking to volunteer, because remember, as I said, 20% of our staff actually lost their homes, so they had to deal with their personal situations. We had one nurse, and we saw this picture where she was just down like this, and you could feel the tears, right? And what was happening for her was that she was evacuating with the patients. Her husband was sent to pick up the kids. He couldn't cross the fire. There was a fire line that he couldn't cross. The kids were therefore separated from him. They were like elementary school age. And so the kids were in the northern part at another airport base. The husband was in the south. she had no idea what was going on, and she was in Edmonton with the patients, right? And so those are the things that our staff were going through. And when everybody in the province, everybody within AHS wanted to help and go up to Fort McMurray and volunteer, that was one of my proudest moments. And it was the first time ever that the premier of the province, the government that created AHS, right? Government creates the systems, actually came out and said how proud we are of AHS. Like, that was probably the moment where I think it was a pivotal moment for the organization, where people were now proud to be working for this integrated healthcare system that could do what it did, because we knew what was happening across the board. So, and I, we really built on that. We created new vision, healthy Albertans, healthy communities together, 5 words, each word so powerful. We had our values, our previous values, nobody could remember. Now it was CARES, compassion, accountability, respect, excellence, safety, just flows off your tongue. And everything that we did from then on was through the lens of the values. And people knew that. So people felt proud. They were happy with what they were doing. We just had sort of a glory period of where it was about, before the pandemic, where everything just worked. The governance worked, the system worked, and we were doing this wonderful things that I shared with you, doing scale and spread for best practices. Those are really the glory years for healthcare in Alberta, and I'm just grateful to have led it.
Wow, so many things come to mind. One is like it makes me miss home a little bit hearing that, because like there is an Alberta way or Albertan culture where you just step up, like you don't even think twice, you just help, you just there's no question that's to be asked. And I think of that nurse and what she would have been going through with her patients and then her family, and like you wouldn't wish that on anybody, your worst enemy, and having to go through that. But at the same time, just hearing how the people rallied and created a culture where you guys were unified for that period of time, really had that similar purpose based on the values you set forth. And I hope this question doesn't come across the wrong way, but if it wasn't for the fire, do you feel like this is somewhere that you could have led AHS regardless? Yeah,
I mean, I think, as I said, the fire was a real catalyst, but there's many events that happen in any sort of healthcare system that could have, sort of brought people together. But I think at that point, when we really landed our vision, because we had no vision, like what the heck, eh? No vision for an organization of 100,000 plus people. But you know what? I mean, I'll tell you a story that was actually quite interesting. Was actually how I started. So, I started on, it was in January, right? So really cold in Alberta. And I knew that in day one that I had to make sure that people could see me as being visible. And I knew that the prior CEO, Vicky Kaminsky, Vicky, did a great job leading the organization. But one of the things that I knew was a gap during her tenure was that she didn't visit one of the zones in the province. You can't do that. You can't just stay in one zone. You gotta treat all the children the same, right? And so South Zone was the zone. And so I just said to my team, I said, okay, well, I'm starting day one in Lethbridge. I'm gonna go out there in Lethbridge, do my town halls, and do it from the site where everyone said, that previous CEO had never gone to visit. Well, I got stuck in Calgary because the Calgary flight got canceled. And I knew that I had a town hall like in 2 hours. And I phoned my office and I said, would it be okay if I took a cab? Because I can't rent a car. There's just no cars. And so it cost $416 to go by cab from Calgary to Lethbridge, in case anyone's interested. And I actually had to do the town hall in the cab, like the first one anyway. I think it was for the southern part of the province. And I'm sure the taxi driver is thinking, like, who is this woman? Like, what is she talking about? But, and then so I went to Lethbridge, I went to Medicine Hat, I toured parts of the South Zone, went to Calgary. Like, I think the visibility and really showing that there is actually a face behind the office building in Edmonton was a really important step to saying, things are now different. And I think it's those things that we as leaders can do to really say to the province that we care about you and we'll make an effort and we want to hear from you. I mean, that's the start, right? And then everything else is ripple effects. But I have no doubt that it would have gotten better and better. But like I said, Fort McMurray, as tragic as it was a real catalyst for the positive for the organization.
I love how you approach that, Verna. Like, people need to be seen. They need to feel valid, important, part of the part of the team. And I think doing what you did out of the gate that sets the tone, right? Like that really, yeah. It's like, hey, I see y'all, and I'm here for you. I'm selfishly, I'm curious, other key like leadership lessons. Like, I mean, I wrote a book on it, and I obviously a bit early in my, I would call it my leadership days. But is there any other kind of key lessons, especially whether that's through your AHS experience or not, that really seem to come to mind?
Well, I think, I could keep going on this forever, Quad, but I just want to share another story that I thought was really
please do.
impactful.
People love stories. People love stories.
So you know how it is when you go touring different places, when you're head of a 100,000 organization and you go to a site or a hospital, whatever, you got a load of people with you, right? Like, so I might be at the head and I've got like 10 people, beside or behind me. I remember touring one of the hospitals in Calgary, and I was going through the emergency department. And there was this woman who was within the janitorial service, obviously, and she was cleaning the hallway, right? And I think one of the things as leaders that we always need to be cognizant of, that I was always very cognizant of, is that everybody plays a role. Everybody. As I said, there's no favorites here. I don't care who you are or what you do. Everybody contributes in equally important ways. And so I remember stopping and just talking to her. I just said, hello, I'm, Verna Yu. I'm the, new president CEO of AHS. And, I just want to thank you what you're doing. I mean, it's so important for, to make sure that, everything looks good for our hospitals. And just started talking to her and asked her, how long have you been with the organization? And, how are you enjoying it? Those types of things, right? And she's, so her story was 15 years, she was obviously an immigrant. She was a visible minority immigrant, but she had been with Alberta Health Service 15 years, and all of a sudden she starts crying. Like, I wanted to start crying. Like, it was very emotional. And it was the first time she said to me that anybody actually even noticed me. And I kind of noticed it, Quad. I have to say that, when I was, so being observant as a leader is really important. Whether you're chairing a committee, whether you're touring a site, being aware of your surroundings, the people in your surroundings, because I kind of noticed and the reason why I stopped to talk to her was because everybody was walking past her, right? There was no acknowledgement of what she was doing, and everybody's really busy. Imagine emergency department. So it's that type of empathy, I would say, that you really try to put yourself in other people's shoes and having that situational awareness.
Yes.
Observational skills, those things are really important as a leader. And I never have forgotten that. That happened very early in my tenure. I actually shared that story with many, just to say, you know what, it took a minute of my time, but the impact that it's going to have on her and her working and, even
her
people, her colleagues even. Anyway, and I think, and you do that, Quad. I mean, you acknowledge everybody in your ICU and everybody in your team. And I think that's why, people so enjoy working with you, right? But, not every leader does that. And I think it's that humility of just saying, everybody's important. And,
Absolutely. And the other part of that too is, because there's a lot of decision makers that they look for specific qualities in leaders, and I can't understate, just similar to the point you made just now, is that ability to have that situational awareness, to read a room, to read the feel of a room, emotional intelligence, whatever the term du jour is, that to me is a must amongst the people that work with us that are going to lead people. You need that skill. It's that ability to read. Hey, this is an idea I'm proposing to the group, and they might be nodding, but are they really into it, or are they just nodding because they think they don't? There's not like a psychological safety in opposing this idea. Like you have, if you want to be effective, in my opinion, this is a must in a leader in 2024, especially in our environment in healthcare right now, where we need people to have impact. We need our leaders to aim high, swing for the fences, because for the reasons we talked about earlier on, we this is a time for change, and we need effective leadership. Absolutely. I love these stories, and it's funny, you know, because this is what people will remember in terms of the interview and our discussion. But I just want to maybe end with where you see our healthcare system going. Like, are you more on the side of optimism? Are you like really concerned? Are you feeling like it's going to be a while before this ship changes direction? I forget the metaphor people always use, but I'm curious to hear your perspective on that.
Yeah, I'm in Alberta, remember, so just putting that into context. You know, I'm an optimist at heart. Claude, you're an optimist. I think that people that are in healthcare, especially in leadership, have to be optimists. Otherwise, you'd be depressed all the time. But after saying that, Claude, I have to say I'm really worried. And I think that we as Canadians have to almost think about revalidating our commitment to publicly funded healthcare. If this is truly what we want as a country, then let's commit to it and stop blaming it. Because I'm tired of the blaming. I'm tired of people saying, oh, well, it's a dismal failure or it's a failed experiment. No, it hasn't been. Like if healthcare systems in Canada was truly a failure, we wouldn't have gotten through the pandemic, which is the ultimate test for any healthcare system. So let's just be grateful for what we have. We're in tatters after a COVID war, true, but we need to recommit to this, right? 1970, it's been, 50 years now of, having a publicly funded system. Let's do another commitment for 50. But if we're going to do it, let's commit wholeheartedly and understand how each of us plays a role in this commitment. That's what I want the system to do. And if we can do that, then absolutely, I have all the hope in the world that we will get through this. But let's do it and do it in a purposeful, concerted way. And let's talk about some of the hard conversations that we are going to have if we want the health system to continue to blossom.
And what's an example of, I know I'm extending this, but what's an example of a hard conversation in your mind that we collectively need to have?
Well, I think, as physicians, I think one of the things that we have to look at is the way that we work in the system and that we participate in the system. Because I can tell you that in Alberta, many physicians saw AHS as sort of, the health system. And I'm a physician with my office in the community, and I don't need to have interactions with you, are very limited. And so I think physicians who are leaders, regardless of whether you have a title or not, physicians are leaders in the healthcare system. We have to own it. We have to be part of it. And perhaps we should be compensated in a way where there's some accountability and responsibility. So fee-for-service models has to go. It does the system a complete disservice in the perverse incentives that it provides. So let's get out of that. Let's acknowledge that we are part of the system. If we're going to be publicly funded, then I need to be held accountable in a respectful but a responsible way, because these are health These are taxpayer dollars.
Wow, that is a solid way to end this, Verna. I am once again so proud of you, proud of to know you, proud to see you accomplish so much in I would say in a relatively short period of time. Your legacy is incredible, and it's been great to reconnect. Actually, it's reinvigorated myself actually. So I really want to thank you for joining us today.
Well, and Quad, I've watched you from afar, because I only remember two types of students, because Quad was a med student when I was in student affairs. I only remember students who may have had issues and the students who are the stars and the ones who really stood out. And Quad, you were always one for me that I knew would be successful just because of the person that you are. And I am also very proud of you and all that you've done and the difference and the impact that you're having. So kudos to you and your family, and all the best for 2024.
Wow, I did not pay her folks to say that, believe it or not, but thank you so much, Verna.
All right. Thanks, Squad.